Mr. Speaker, the upcoming legalization of recreational cannabis use in Canada has prompted property managers to examine their policies about tenants' cannabis use for both recreational and medical purposes. One constituent who uses medical marijuana and is a Calgary Housing resident told me the City of Calgary will prohibit pot use on their properties, even for medical purposes. What will the Health Minister do to ensure that my constituent can continue to receive quality of life benefits from medical marijuana in Calgary Housing?
Very good. Honourable Minister of Justice and Solicitor General.
Thank you very much, Mr. Speaker. And we do know that as we've moved forward with the federal decision to legalize cannabis, that there are a number of decisions that need to be made. A number of people throughout the province live in communal buildings that have, whether they be apartments, whether they be supportive housing, Mr. Speaker. As we move forward, we'll be having those conversations with those individuals. We have given the landlords the mechanism to be able to make those decisions for the safety of other folks in the building, Mr. Speaker. But if the honourable member would like to follow up with the specific concerns of that constituent, myself or the Minister for Seniors and Housing would be happy to speak with them.
Thank you, Honourable Minister. First supplemental.
Thank you. I appreciate that. Given that there are tens of thousands of Albertans who rely on accessible housing, at least some of which who also rely on medical marijuana to address health issues, and doubtless many more who might consider medical marijuana with their health care providers, what direction can the Ministers of Health and Municipal Affairs provide to ensure that Calgary Housing Company and other municipally owned housing providers do not force patients to choose between their health and their homes?
Honourable Minister.
Thank you very much, Mr. Speaker, and to the member for the question. As we know, there are a number of complicated issues that have been raised around this file, and this is just one of them. Municipal governments, Mr. Speaker, are another order of government, and ultimately we have given them the power that they requested to make the decision in a number of areas, and we're going to respect their ability to make those decisions, Mr. Speaker. In terms of provincial housing facilities, Mr. Speaker, obviously we'll have to have those conversations, but we do need to consider not only the health and safety of individuals using cannabis, but the health and safety of other individuals who live in the building.
Thank you, Honourable Minister. Second supplemental.
Given that there are tens of thousands of Albertans who rely on housing in senior communities, supported living and long-term care, and who may benefit from medical marijuana, what are you doing to ensure that they can use medical cannabis when living in housing provided by non-profits and other organizations that are funded, at least in part, by provincial and other public money?
The Honourable Minister.
Well, again, Mr. Speaker, as we move forward, we do know there are a number of conversations to be had around this issue. Ultimately, Mr. Speaker, buildings that are owned by folks other than the province, those private property locations, are free to make their own decisions, and we're going to respect those decisions, Mr. Speaker. Certainly, I understand that the federal government will have more to say on the legalization of products other than smoked products, but, Mr. Speaker, there is a very delicate balance to be struck here. There is the health of the individuals who seek the use of medical cannabis, but also, Mr. Speaker, there's the health of individuals, other individuals who live in the building who may not want to be exposed to smoke.